Do you think you might be tongue-tied? So we're going to first talk about how to assess an anterior tongue tie, and then in the next video we'll share with you how I like to assess a posterior tongue tie. So as you may know, with regards to the tongue, there's an anterior tongue frenulum that we can see typically on some people. It might look like that little string that attaches the base of your tongue to the floor of your mouth. But the posterior frenulum you cannot see. You would have to cut away the anterior frenulum to see the posterior. So just to give you kind of a quick brief overview about how you could measure for this. The first thing is you want the patient to be able to open their mouth as wide as they can, and assuming that they're not dealing with any temporomandibular disorder and they can open fully, that's going to give you an accurate measurement. So first with Joe here, we're going to have him open as wide as he can. We're going to get there and measure with my caliper, and we've got Joe at 50 millimeters. So then we start to look between a grade 1, 2, 3, or 4. When it comes to an anterior tongue tie, grade 1 is if you can open greater than 80%. So in Joe's case, right, that would be if with his tip of his tongue up, if he can open at least 40 millimeters or so, he would meet that. Grade 2 is somewhere between 50 and 80% of full opening. Grade 3 is anything less than 50%, and grade 4 would be less than 25%. So what works for me is I like to have people say the letter N or the word nice. And if you do that, you will notice the tip of your tongue, if it can actually elevate, will lightly touch the roof of your mouth, just slightly behind, but not on your front teeth. So we're going to have Joe put his tip of his tongue against the raphe, or that roof of the mouth, and then he's going to maintain it there as he opens as wide as he can by keeping it there. And with Joe, we tended to find consistently he's at about 30 millimeters when we do that. So that would put him at about the 60% range, so possibly a grade 2 of a tongue tie. Is that relevant or not? It depends. We want to put all the different factors together, right, as part of our evaluation or assessment. What I like to use, at least when I teach my basic classes, anything less than 50%. So, right, if someone opens the 50 millimeters and with their tip of their tongue up, they're at 25 millimeters only, right, pretty good indication that they at least have an anterior tongue tie. So this gives you just kind of a quick idea on how to assess for an anterior